Hi, this is Travis Lindsay. I'm here today at the Tyler Internal Medical Clinic in Tyler, Texas. I'm here with Mandy. Mandy is a nurse here at the clinic. And what doctor are you working with, Mandy?
Dr. Thomas Busby.
Okay, very good. And again, just ask you a series of questions relative to your experience with the products. And I guess the first one, what gave you the confidence to recommend Max products, either GXL or Max One, to your patients?
Well, I started listening to other people's testimonies about the medication, and I started taking it myself and started seeing results, and so
Okay.
that's when I knew I was confident enough to give it to other patients.
Okay. What results, just real quickly, did you experience?
More energy, sleep. I feel well rested in the morning.
Okay. Got to be a big factor working as hard as you do through the day.
Yes.
Okay. Very good. Um, and kind of tell me, and we've asked some of the other nurses here, but and see if it's the same. But what process do you work with Busby in terms of the patients? Does Busby make a recommendation? Do you make a recommendation to the patient? How does that work?
Both. We both make recommendations, but a lot of people, because of the literature that we have on it in our rooms,
Okay.
they seek it out themselves a lot of the times and ask us questions about it.
Okay. Well, that makes it easy.
Right.
And just kind of one thing that I would like to know, and probably the audience would want to know, in terms of making a recommendation to somebody, or, and I guess let me ask it this way, what would be the most impactful thing with a patient that you've seen that, in your opinion, Dr. Busby's opinion, one of the Max products or both was beneficial to the patient?
Well, we had this particular patient that he didn't do any kind of exercise. He was sluggish. He was overweight. He started taking it and started running on a treadmill. He had never ran on a treadmill, and he's lost like 30 pounds. I mean, he has more
Sure.
energy. He says he's young again.
Okay. Now, as I'm hearing you say that, if you've got a patient that is out of shape and you put them on the product, is there a danger for having them exert themselves in a way they haven't in a long time?
No.
Okay.
A lot of people need that.
Yeah, well, without a doubt, and that's kind of the reason I was asking, because I do think it's, and have seen, giving people the stamina, the energy, and reason to kind of go out and do things that they have not done.
Right.
In terms of physical exercise, whatever it may be that they need to do. Have you seen any, or do you know of any reactions to medications, et cetera, or is there somebody that should not take the product that you know of?
No, we haven't had anybody that we haven't given it to that's wanted to try it. The only thing we've seen is just regurg, and that's it.
Okay.
No other symptoms.
Now, is that with GXL
Yeah.
exclusively? As Max One kind of eliminated
Right.
that?
Max One has eliminated it.
Well, that's what we've heard, where I've seen is, changing that. I think the N-acetylcysteine caused some regurg in some of the patients, especially if they didn't have any food in their stomach,
Right.
et cetera. But Max One has changed that. Is there anything negative at all that you've seen with the products?
Nothing negative.
Nothing at all?
No.
Okay. Would you recommend it to anybody that you know of, see, family, friends, et
Yes,
cetera?
I mean, I wish my grandparents would start taking it. They're in their 80s, and my grandmother, she can't get around very good.
Mhm.
She has a bad back, and her hips are bad. And I'm working on her right now, trying to get her to start taking it because I think it would make her feel better.
Yeah.
She's having to do physical therapy, and a lot of our patients that have been on it, they don't take as many of their medications anymore.
Okay. So, and as you say that, the patients that you do put on the product, are they specifically asking you about it?
Right.
Or if someone doesn't ask, do you make a recommendation, or is it strictly the patients that ask you
No,
about
we
it?
make recommendations also.
Do you? Okay.
hmm
And how long have you been working with Dr. Busby?
10 years.
Is that right?
Mhm.
Okay. Awesome. Very good. Well, I appreciate you letting us ask you some questions and put you on the spot.
Thank you.
But thanks again very
Thank you.
much.